So one of my coolest patients ever, this 84-year-old dude, I was seeing him for, he had a hip replacement and going there to change his dressing, make sure he's doing okay. First thing I go meet him, he's got a real nice house. Go in, he shakes my hand, he crushes my hand, but like I still respected it, like he wasn't like trying. He just had like some bone crushers. He doesn't look like an 84-year-old. He's like probably like 6'2", handsome fella, good shape, lean but muscular, great posture, just walking around like, he looked like a superhero. So I go into his house, he takes me in, it's real nice. We go to his office, which has like a bunch of military stuff on the wall, like trophies and medals, and trophies for like golf. And that picture of him with he got a hole in one. I do all the vitals and everything, and I start checking him out. Everything's literally perfect. I start changing his dressing. His wound is basically healed. That's normal. He's like 1 week post-op. Usually the wound is pretty healed up. They glue it and everything and staple on the inside or suture on the inside. I'm looking at the wall of the golf stuff, and I tell him like, hey, we'll have you back out there, playing in no time. And he's like, oh, I played golf yesterday. And I'm like, oh, you did? Okay. Does your doctor know about that? And he's like, oh, yeah. And the guy's just like, so matter of fact, but cool. And he was telling me his wife was a nurse. She was actually a home health nurse. So he's 84, right? He had some pain meds that he didn't take. And his only other medication was Cialis for daily use. Or maybe more than once daily for this guy. Okay, so his wife came in while I was doing his dressing change, and she was maybe 55, somewhere between 55 and 60, maybe. She was still working. Like I said, she's a home health nurse. She came in for like her break, and she was a good 55, like she took care of herself. She looked healthy, and she was aging well, if you know what I mean. So she comes in, this, 84-year-old fella, he goes, hey, this is my wife, this is Josh. And he looks at me and he kind of gives me like and I'm like, oh, okay. Anyway, I'm just like, all this stuff is sinking in, he's got like this trophy wife, he's got beautiful house, like really good looking old fella, basically perfect health, especially for 84. He just kind of worn out his hip joint from being so active. And I kind of look at him and I go, sir, you know what you are? You're Captain America. He goes, that's right, I am. That's actually what people call me. I was like, all right, Captain America. So yeah, he was awesome. We discharged him the next week, obviously, and he's probably out saving the world right now. So he was probably expected a joke about Cialis, but Captain America, wasn't he like 116 years old? He definitely had some prostate issues, probably some blood flow problems. So it's okay. All right. Thank you for your service, Captain.